The Crowd and the Cloud is made possible by NSF, the National Science Foundation, where discoveries begin.
It's individuals and families who get sick. But sometimes it's their neighborhoods that trigger illness. And that's true for asthma in Louisville, Kentucky, or West Oakland, California, and for dengue fever or Zika in tropical climates, or cholera back in 19th century London. But how physicians and communities fight back is being revolutionized by technology.
We typically make it to the tops of lists that people don't want to be on the tops of.
Once it was pen and paper and pounding the pavement. Now it's sensors and smartphones, inexpensive microscopes, and smart software.
But we don't want to complain. We want to work with to change something.
Today, apps that began in Silicon Valley can be customized to fit local conditions in Kenya, empowering community health workers to compensate for the lack of doctors.
So if we get a text message and it saves a pregnant mother, that's big, man.
In Barcelona, Brooklyn, and New Orleans, apps and citizen science can combat the spread of disease-bringing mosquitoes.
The citizen power is the right power.
I'm Waleed Abdelhadi. I've worked for NASA and used satellites to study Earth from space. But I'm increasingly convinced that today's technologies and public participation in science can tackle long-time problems in totally new ways. In this episode of The Crowd and the Cloud, citizens and sensors, smartphones and social media, all working together to empower public health science, unleashing viral versus virus.
The Crowd. The Cloud.
The Crowd and the Cloud.
Viral versus virus.
More than 25 million Americans, 1 in 14, suffer from asthma, a disease that makes it hard to breathe and kills 10 people in this country each and every day. Here's how innovative technology, linked to an inhaler, is helping citizens manage their asthma in one typical American city.
Under 3 minutes.
Yes. I need my thing, Mom. My name is Mason. I am 9, and I live in Louisville, Kentucky.
1, 2, 3, 4, 5.
Louisville, Kentucky is one of America's asthma hotspots. 13% of the city's population suffers from the disease.
It feels like an elephant is sitting on my chest.
You feel chest tightness, your heart hurts, even though it's not a heart attack, but you feel it because there's just your body, basically, everything's rushing to try and get you to breathe.
So Louisville's air quality has been a challenge for a very long time. We typically make it to the tops of lists that people don't want to be on the tops of. So, the 4th highest rate of asthma nationally, one of the 10 worst places to live if you have breathing disorders, and allergies. I mean, we've looked at some of these lists and the people that make them and said, our goal is to get off your list.
One of the first calls Ted Smith made was to David Van Sickle, CEO of Propeller Health.
Every year in the United States, asthma still causes millions of emergency room visits and hospitalizations.
Van Sickle's company was developing a sensor to track the inhaler use of asthma patients. He came up with the idea after studying a mysterious asthma outbreak in Barcelona in the 1980s.
There's a classic study from Barcelona, Spain, where it took about 10 years for a team of expert physicians and scientists and public health officials to understand that these significant outbreaks of asthma that were occurring and sending lots of people to the hospital and were caused by a lack of appropriate filters in harbor silos. They put on a map for the first time the locations where people's attacks had begun. It was really the first time that an asthmagen like that had been identified that was causing these community-wide outbreaks of pretty severe disease.
The challenge? How to track community asthma attacks in real time. The answer? A sensor small enough to fit in your pocket and able to connect to a smartphone and upload data.
We had this idea that chips and sensors and radios had become small and cheap enough that they could now be, actually physically built into the medications that people take.
It took a couple of tries and a few clunky prototypes, but Propeller's current sensor fits seamlessly on top of a typical inhaler.
So the Propeller sensor is this device. It attaches to a patient's existing medication and then passively tracks when the medicine is used and sends that information on to a smartphone.
Richmond?
In 2012, the city of Louisville partnered with Propeller to begin distributing these sensors to its citizens. Dawn Sirik is one of them.
If you're a non-asthmatic, then you don't have to think about breathing. When you're an asthmatic, breathing is exhausting. It can be all that I can do some days is breathe. This is what asthma means to me. I do this inhaler twice a day, this inhaler twice a day, this inhaler twice a day, and then this inhaler as needed. I track all of these medicines with the Propeller app on my iPhone. Every time I use my inhaler, it sends a signal to the app and it logs it for me. It gives me all kinds of details. It tells me how many days in the last month that I've had symptoms, how many times I've used my rescue inhaler this week. It tells me the last several months how compliant I've been with my daily meds.
It lets you see a trend of how the patient is doing. It allows us to outreach to the patient to kind of see what is going on. Is there an issue that we can catch prior to them getting to that point and making it to the ER?
Dr. James Sublett is director of Louisville's largest asthma center.
Okay, I see how you're doing here. The big benefit I see is we get proactively the reports of people who are needing some intervention.
Prevention is especially important to Dawn because she sees a lot of asthma cases as a pediatric nurse at Louisville's Cossair Children's Hospital.
We're getting into respiratory season where most of our kids are respiratory kids. Kids with asthma come in and they can't breathe. You have to have somebody at your bedside all the time. You take a lot of resources. It's very serious. I think the sensors are going to revolutionize asthma treatment. It's helped me figure out what my triggers are, because I had no idea 6 months ago what my triggers were.
I've come to rely on using the sensor. It's on the main inhaler that I keep with me. It's helpful because it does track. It tracks all of it. I can go in and it shows me a map of exactly where I was when I used the inhaler. I can go in and put my triggers, that it was exercise, and then symptoms I had. It shows me a sad face because it says asthma is not well controlled. So I've been using it for a lot of strenuous activity, exercise, but the orange is the days that I've used it over the last week. It's really nice to be able to see the data, to know instead of just trusting your instincts or your gut, but you can pull that information out and you can graph it and you can plot it and you can play with it.
We can, over time, build up a picture of why they're having symptoms, when and where they are, and hopefully be there as a companion to help unravel this mystery of what's causing their asthma to worsen when it does.
Yeah, it actually puts my mind at ease when he's not with me. I'll know whether or not his asthma is acting up when he comes back to me regardless. Because if it is, then I'll know I need to go ahead and make this appointment, get him on some steroid medications or whatever.
The data is used for more than diagnosing an individual's symptoms.
Where people use their rescue medications, their inhalers, is really an important marker of what's happening in the community. There's lots of small area spatial and temporal variation in what's happening with asthma, but we've never been able to capture it because we've never looked, right? It's never been visible before.
Applying the same insights gained from studying the Barcelona outbreak, Van Sickle and his team hope this data can be used to identify asthma hotspots all across the city.
So we have, with this citizen science project and with this citizen collected data, we have access to data that's never ever been available before. And so we can look for patterns of asthma across a region and then do analyses to try to figure out what might be driving those attacks. And so it'll really give us a great picture into what's going on in Jefferson County. We did find significant clusters. We can see a cluster in the sort of southwest area, a cluster over downtown. Interestingly, we saw a cluster that was just east of downtown, which is in a more affluent area, which was something that was very unexpected.
They'd expected most asthma attacks would be triggered by industrial sources, but it turned out wind direction could move pollution to areas with no such sites.
I think that it's good that we're all connected. We all have the same sensor that goes to one central location. So the data all is being pulled from different people. So they could live in West Louisville, East Louisville, South Louisville, downtown. Even some in Southern Indiana. If 50 people all use their inhaler within 20 minutes, if they all look like they're in the same location, say like Thunder over Louisville, okay, maybe fireworks aren't the best thing for asthma. Maybe we're gonna recommend that you don't go to the river and watch the fireworks. Or if you do, you take more precaution because it seemed like everybody in the city was using their inhaler at that time.
We look to programs like this as this are the things that we need to do in our community to change the statistics for these diseases here. We will get the economic benefit. We will get fewer ER admissions. We will get more productive days in the workplace. But more importantly, we'll get a place where people want to live.
Ports bring jobs and all the good things that go with them. But loading and unloading ships and the trucks that service them can also deliver pollution to surrounding communities. And that's what was happening in West Oakland a decade or more back. There, it was data collection and citizen science that set the city and the port on the path to cleaner air and better health.
My son, Orvon, who's the light of my life, I thought he just had a cold. What he would do is he would get up and he would crawl to the middle of the floor where it was cool at, and he would just lay there, and you could just see his little chest going up and down, up and down. If I would have been 2 more minutes late getting my son to the hospital, it wouldn't have been nothing they could have done. His bronchitubes would have closed up on him and he would have been gone. I think if I would have lost that one, I would have lost me.
Cassandra Martin works with the West Oakland Environmental Indicators Project, an organization that addresses poor air quality in her neighborhood.
When it's small like that, that's when it gets to be really, really dangerous and serious, okay? One of the reasons why I started doing this work, all 3 of my kids have asthma, and so do I.
The issue of asthma was the #1 problem in West Oakland.
Margaret Gordon co-founded the Indicators Project.
Okay, I'm gonna send you the study that was done on environmental justice for the 21st century. Okay. All this is considered the West Oakland district, all the way around the support of Oakland. It has been a poor planned community for over 50 years. People living all through here with those industrial areas. Here we are right here.
West Oakland is surrounded on all sides by 2 interstates and the Port of Oakland. Industrial growth has meant citizens are forced to live with pollutants and contaminants.
What was the science saying from within inside of the community that triggered people to have asthma? The citizen science helped us look at root causes. One of the root causes was the shipping business.
So this is my little West Oakland fixer-upper. It was built in about 1886.
Brian Beveridge is the organization's co-founder.
Just over that hill and beyond that sound wall is the 6-lane, 8-lane freeway. So we started with existing information to look at this snapshot of the neighborhood. And that allowed us as a community to prioritize the issues, and there were many. The community then said, well, what is the key health problem? Well, it appears to be diesel pollution from the whole freight industry.
The port is over 500 acres of land. They have anywhere from 12 to 18 docks. They move on the average maybe 500,000 containers a year.
To address this problem, the Indicators Project led various truck surveys going back to 2001. The idea was simple: count the number of trucks passing through various parts of the neighborhood.
The people of the neighborhood had been running back and forth trying to get somebody to care. And it wasn't until we were able to get some funding and decide, well, if no one else is going to do a traffic analysis of the trucks, we'll do it ourselves. So we taught community members to sit on the corner in a little lawn chair with a clipboard, and they counted trucks. We did it under the oversight of professional traffic surveyors, and we had research assistants to then assess the data.
Armed with numbers and hard data, and not just complaints and anecdotes, the citizens got the city of Oakland to listen.
So we took the data from the traffic survey and went to our city council member and said, we want to do a truck route ordinance.
This is where trucks traveled through the neighborhood before the Indicators Project mapped their routes.
For the most part, we were all able to rationalize the logic of having the trucks go on the freeway around the neighborhood rather than right through the middle of the neighborhood.
And here's how the community science data helped move polluting vehicles away from schools and residences and toward the perimeter.
So that was very successful. It was a unanimous vote at City Council when they changed the ordinance.
Next, after the truck survey, the Indicators Project began collecting air quality data using an Intel-created air monitor called a dust tracker.
When you have it right there in black and white to put in front of their face that this area is contaminated and this is what you're doing to people, if you don't have consistent data to back up what you're saying, then no one's really gonna listen to you.
We're not going to experts and asking them to please apply their expertise to us. We're going to experts and saying, we are experts too. We are experts in our own community. We're experts in our own lives. And we can prove it. We can work together.
What I want you guys to do is get in a habit of whatever you smell.
Now Cassandra is training local teens on how to document other sources of air pollution.
Can anybody tell that smells maybe like the garbage can?
These students are part of a summer program sponsored by UC Berkeley's East Bay Academy for Young Scientists, or EBAYS.
The circle with the circle is the one that turns the GPS on, and then you'll get a green light here on the satellite.
The teens patrol the neighborhood alongside Cassandra, mapping potential sites of pollution.
The citizen science, as they call it, is really powerful, what we call community-based participatory research, new buzzword, and it's powerful beyond the data. There's also an element of understanding your own life, that sort of filling in the blanks or adding a lot of color to the picture of our world. Things we hadn't noticed before now become things we notice.
Hello, how are you? Hi, how are you?
The students come away with an understanding that once you have this factual information that can't be disputed, mainly as a result of the fact that the students are using professional equipment and protocols that are accepted by the Environmental Protection Agency and other scientific bodies, they can push policy makers to perhaps mitigate some of the problems that they uncover.
eBay students aren't just collecting data from the streets. They're going underground to the stations of the Bay Area Rapid Transit System, or BART.
The study essentially entails students traveling to various BART stations and ascertaining the concentration levels of particulate matter in those stations, both indoor stations and underground stations. The Embarcadero BART station, which is the most frequently used BART station in San Francisco, we found that particulate matter concentration levels there were through the roof, way above Environmental Protection Agency mandated standards.
Dustin Grezik is one of eBay's instructors.
When the students have been able to go out and walk around the community and collect data and then observe things, they understand the correlation between the data and the sources of the pollution that they're interested in.
This is called the dust tracker. It measures how much dust and particulate matter there is in the air. Particulate matter is the little dust particles that we can't see. The more cars pass by, the more particulate matter there is, and the less cars that pass by, the less there are.
So the air filter in there's a cartridge. We could send that out and test the particulates. And they found that it's different kinds of metals, and most of those things are from the brakes, from the wheels, and from the tracks. So if you think about metal, you're breathing in bits of metal.
Especially like the police officers that have to be down here all the time, like the security guards.
Yeah. Because of the low-cost sensors available in the smartphones or other devices, the students can collect data and immediately begin interpreting them.
In December 2015, some of the students presented their findings at the American Geophysical Union, which is one of the largest and busiest gatherings of professional Earth and space scientists.
I mean, coming to AGU, like that's amazing. Like I didn't really realize how big of a deal it was until I started looking into it. We have something to bring to the table too, just us high school students, and people want to hear what we have to say.
Yeah.
It's kind of exciting.
Yeah.
What I'm doing like really matters.
It does matter.
Yeah.
It does matter.
It gives us hope. Like we might change something. Make a change to BART.
We sometimes frighten the statisticians because they would prefer to have a little bit of perfectly pristine, absolutely, 100% data from $1 million machine. And we're saying, no, let's take this, $200 machine and start making decisions based on it. But the notion is that if you had, $1 million machine, you can do so much with that. But if you have $1 million $100 machines, all spewing data into the cloud, turning it back to us as in a direct feedback loop, then we start to adjust behavior immediately.
Has anybody else noticed anything else? I believe in what I'm doing. I love what I'm doing. I'm learning about toxins. I'm learning how it affects you. I'm learning how it attacks the body. I'm learning how to teach other people to do what I do so they can do it for themselves and to better protect themselves and their families. And for me to be able to make that difference is important to me.
Cities, of course, want booming economies, and that often means busy docks and crowded airports, and that's a good thing. But today's international commerce means that diseases travel from continent to continent. Illnesses such as cholera and Zika can go global as well. Mapping disease is often the first way to fight back, as we saw in Louisville, and that's a story with a fascinating but little-known citizen science angle. Or maybe I should call it clergyman science, but it's when individuals mapping an epidemic first show the value of street knowledge and boots on the ground. As a famous Londoner of Victorian England, Charles Dickens, was to write, "It was the best of times, it was the worst of times." Richard Barnett is a historian of medicine and our guide to what happened.
In the mid-19th century, London was the largest city on Earth, with a population of more than 2.5 million. It was the capital of a great worldwide empire, a truly globalized city like modern-day Mumbai or New York. The docks along the River Thames were filled with ships, and those ships were crammed with goods brought from around the world.
These ships carried more than just their cargoes. They brought death to the heart of the new industrial cities. Cholera came to London for the first time in 1832, and in a few months, it killed more than 6,000 people. The magazines called it King Cholera, but its causes were far from clear.
Walking through the Victorian city, it seemed obvious to most observers that poverty and disease went hand in hand with stench and dirt. These filthy streets and houses stank. We're in Soho. It's a bustling district filled with theatres, bars and restaurants. Victorian Soho was lively, dirty and poor, crammed with prostitutes and priests, brewers and businessmen. And like all Londoners, they needed to relieve themselves somewhere.
For centuries, Londoners had emptied their chamber pots into cesspits in their cellars. Every few weeks, the Knights Yeomen cleared out the contents and carted it off to the farms surrounding the city. Urban waste became valuable fertilizer.
Mainstream medical theory saw a direct connection between these bad smells and epidemic diseases like cholera. Anything that stank, whether it was sewers, factory chimneys, dead bodies, was releasing poisonous vapors, miasmas, into the air.
Inspired in part by this miasmatic theory of cholera, the government passed the nuisance laws banning cesspits and ensuring that new houses had sewers connected to the Thames. This looked like progress, and if that airborne theory was correct, it should have solved the problem of cholera.
The Thames, only a few decades before, had been a fairly healthy river, home to salmon, eels and herring, but no longer. The builder, Thomas Cubitt, observed that the Thames is now become a giant cesspool, instead of each person having one of their own. Worse, more and more Londoners were having their drinking water pumped straight from the river into their homes. The physician Arthur Hassall pointed out that wealthy Londoners were not only consuming a portion of their own excrement, but also paying for the privilege. With hindsight, we can see that a law intended to prevent cholera in reality had created a great cycle of reinfection.
Cholera came again in 1848, killing more than 60,000 this time. And 6 years later, in 1854, a smaller outbreak hit Soho.
Fewer people died, but a brilliant physician and a local clergyman found an entirely new way to visualize disease and to understand its causes.
The doctor's name was John Snow.
Today, he's celebrated by the medical profession, and in typically English fashion, this teetotal doctor has a pub named after him, only a few streets away from where he'd lived. The clergyman in our story was the Reverend Henry Whitehead, then just 29 years old. Whitehead had absolutely no medical training. Today, we might call him a citizen scientist, but it was his knowledge of the area and its residents that helped him to solve the mystery of the 1854 outbreak.
Cholera is a cruel killer. Uncontrollable diarrhea means most victims die of dehydration and organ failure within days or even hours. In just 2 days, cholera killed 10% of the people in this neighborhood, and many others fled.
But not Snow. His experience of previous epidemics and his work on anesthesia led him to think that poisoned air could not possibly be responsible. Like another famous Londoner, Sherlock Holmes, Snow turned detective and went looking for clues.
The poor of Soho could not afford piped water, and so they used public pumps on the streets. Snow suspected that the water from these pumps was spreading the disease, but he needed evidence, strong evidence, to convince his medical colleagues and the local authorities.
In just one day, Snow collected detailed information from the family and neighbours of more than 70 cholera victims. He and Whitehead pounded these pavements, going door to door. Their big question was, where do you get your drinking water? Workers at a local brewery, the Lion, which stood right here, seemed to be immune to cholera. Of 70 employees, not one died. But Snow discovered that the workers were taking their water from a private well inside the brewery. Or, better still, they drank only beer. Snow's researches turned up another geographical clue. Susanna Ely had left Soho after the death of her husband, and she'd come to live here in Hampstead, a village a few miles north of the city. But she'd acquired, heaven knows how, a taste for Soho's pump water. She had barrels of the water brought up to her house, she drank it regularly, and she died of cholera. This red curbstone marks the exact site of the pump on Broad Street. Snow found that cholera deaths clustered around this pump famous for dispensing the sweetest water in Soho.
Whitehead, putting his community knowledge and social connections to work, found what today we'd call patient zero.
Baby Lewis, we don't know her first name, lived and died here at 40 Broad Street. Whitehead found that her mother, Sarah Lewis, had rinsed diarrhea-soaked diapers in pails of water for several days after her baby had fallen ill.
Then she poured the contaminated water into a cesspool beneath her house. Excavations later showed that this cesspool had been leaking into the well that supplied the Broad Street pump. Its sweet water had turned deadly. Here in Soho, Snow showed that this new way of thinking about disease could have practical, real-world consequences. Take a look at this map. This was published in a book that Snow wrote about cholera in 1855. He took a map of Soho and he marked on it the location and number of deaths from cholera. In doing so, he showed very clearly that deaths from clustered around the pump on Broad Street. Now, Snow himself lived only a 5-minute walk away over here on Frith Street. So this epidemic was happening in his neighbourhood. He was deeply familiar with it, and he and Whitehead used their local knowledge to see things that others simply couldn't see. This is a simple and a brilliant presentation of what we now call geocoded data. And it shows why maps, whether they're made with paper and pencil or satellites and smartphones, are central to the work of medical detectives.
When it was rediscovered in the early 20th century, Snow and Whitehead's work inspired a generation of public health doctors and epidemiologists, and it continues to do so today. Many of them see Snow's map as the founding charter of geomedicine. And it wouldn't have happened had Snow and Whitehead stayed in doctors' offices and clinics. It took a potent mix of citizen science, shoe leather, and map making to track and confront a killer.
Dengue fever, chikungunya, Zika. Until recently, these diseases were unfamiliar to many of us. But now viruses that originated in forests far away are being found all over the world. They're spread by mosquitoes like Aedes aegypti or Aedes albopictus. Researchers think that a warming climate will bring more exotic tropical diseases in the coming decades. But they also think that citizen science and innovative apps can be a powerful way to fight back.
So what we're doing now is entering the Fifth Ward.
Aedes aegypti is a mosquito that lives in very close association with humans. They only feed on humans.
Here's a good poster child for Zika right here. There's the discarded tires. There's the houses without window screens.
When we go actually out to look for Aedes aegypti, we can guarantee that we're going to find it in the poorer communities. The mosquito that spreads Zika, dengue, chikungunya are container breeders.
And so they live in tires, they live in flower pots, they live in bird baths. Those have to be emptied.
And it's no longer something far away in tropical regions.
Oh, no, it's all right here.
I don't see how we're going to effectively control Aedes aegypti mosquitoes and prevent Zika without the community involvement. The community's got to be out in front on this because if you only rely on traditional public health control measures and institutional health organizations, they can't do it all.
It's house to house, going into poor neighborhoods, hard slogging. It is the poster child for citizen science.
Barcelona, Spain, one of the world's most beautiful cities with parks, fountains, and plentiful water. As early as 2004, Spanish researchers had begun to find an invasive mosquito species, Aedes albopictus, known as the Asian tiger mosquito for its distinctive white stripes. Initially, we knew it carried yellow fever and dengue, but we've since found out that it transmits Zika as well. In 2013, researchers began to enlist citizen scientists using a smartphone app to record where tiger mosquitoes were being found.
Everyone in this city has been bitten by a mosquito, and it sucks. I mean, that's the truth. So by reporting this, if I can help in any way, like eradicating or controlling the mosquitoes, well, I feel well about it. I mean, and everyone should feel the same.
Conocí la aplicación Atrapa el Tigre a través de la prensa escrita. Un día yendo a trabajar leí un artículo y me interesó y me descargué la aplicación y empecé a leer y a utilizarla. La aplicación Mosquito Alert es fácil de utilizar, es intuitiva, fácilmente te muestra cómo poder identificar la especie Aedes albopictus o también Aedes aegypti. Y es muy, como decía, muy fácil de meter imágenes, también comentarios de texto y también geolocalizar los hallazgos de mosquitos.
Mosquito Alert is a very good project because it is centered in a very big problem. That is, we have been invaded by new mosquito species. And of course, detecting them and avoiding them to reproduce is the key point.
Through the efforts of citizen science proponents such as university professor Josep Pareo, the city of Barcelona supports a municipal Office of Citizen Science, the first such office anywhere. City officials help fund Mosquito Alert as one of 6 pilot projects.
So citizen science for me presents a totally different ethics, where the data becomes a shared resources. Here in Barcelona, we're talking about data commons, which is a common good, a public good, that can be used to improve people's life.
Mosquito, I guess, is expanding right now. So being able to tell where it has arrived recently, I think it's like the most important preventive action you could take.
We have thousands of people running the app in the mosquito period. We are empowering citizens, that's for sure, that's part of the revolution. You're empowering citizens to do research and to promote information and to be informed themselves.
Smartphones, and particularly smartphones that have GPS receivers, they're essential for our project, which means that we can not only have people with an incredible sampling tool available, we can also have something that's essentially a part of this person's body, an extension of this person's existence, which is constantly transmitting information back and forth, and which can be used to communicate with us and with other citizen scientists.
If you participate in this project and you are part of a group sending these pictures, and then you are informed about which actions are being taken, I think somehow you feel that you're fighting with the problem, against this problem, but with your community. And I think this is one of the most important motivation for participating.
We're learning about the distribution of mosquitoes in ways that we couldn't learn before. We're learning at larger scales than we'd be able to otherwise know. So we know a lot more about the mosquito distribution in Spain as a result of this project. So we start to learn about how mosquitoes seem to be using global transportation, global commerce chains, and also medium-scale transportation, probably hitchhiking in cars with people.
This map documents the areas where traditional methods were used to trap tiger mosquitoes. Reports from the Mosquito Alert app delivered evidence of a much more extensive geographic distribution.
That's a big difference, and that's something where Mosquito Alert has been very useful in giving us the data that we need to analyze those questions.
I think one of the benefits of mapping things is to make things clear, understandable, and public to everyone.
Mosquito Alert started as a way for professional scientists to get better data for their academic research. Soon, citizen scientists added practical and immediate uses.
What I was telling citizens that I would do with their data is I'm going to make maps and I'm going to make predictions. But the same citizens start to ask us, look, we really have mosquitoes here. Can you help us to get rid of these mosquitoes?
Mosquito Alert also invites feedback from users.
So we're the same notes of the citizens through the app telling us that they wanted something more than research and a map. So therefore we started to have contact with management people, with the people that has the real skills and tools, and they are capacitated to control the mosquitoes in the city.
So I think probably the most important result is the ability to detect mosquitoes in locations that we wouldn't otherwise be surveilling or sampling using traditional methods. As they're helping us to discover these new areas and to see how mosquito populations are changing, they're also understanding the mosquito themselves, and they're sharing that information with our friends.
Cada semana utilizo la aplicación. Cada día suelo estar en parques, por la calle. Si me molesta un mosquito tigre, allí estoy yo para cazarlo.
We can not only say that we are doing science with their data, but we are doing management. So the more they report, as this information is entering in the public health agencies, the more they will be having someone controlling for their mosquitoes locally.
Los beneficios que obtenemos de la participación de los ciudadanos mediante sus incidencias o mediante los informes que recibimos de la aplicación móvil nos ayudan no solo a mejorar, sino también es una forma de implicar a la sociedad con las acciones y el trabajo que desarrollamos desde la administración pública.
The university researchers compared the accuracy of reports from citizen scientists against traditional surveillance techniques. They found that the volunteer data is equivalent in quality, but can expand more quickly and more economically over large distances, complementing the efforts of public health agencies.
So it's not that citizen science is better at this moment, it's exactly the same. So we have the same data quality that we would have with scientific methods that have been used for decades.
I think Mosquito Alert is an easy platform in order to gather information. The citizen power is the right power.
The thing is citizens working for the citizens and for the city, and I think that's like the biggest benefit from all. Because I mean, all the citizens from the town benefit from the work I'm doing. I benefit from the work others are doing here in town.
Now the Spanish researchers hope their app can go global, just like mosquitoes and tropical diseases have done. Mosquito Alert has already been translated into Chinese and is being tested in Hong Kong. And in the United States, the GLOBE program, an international science education project supported by NASA, NSF, NOAA, and the State Department, is adapting a mosquito identification protocol for citizen scientists that was previously used in schools.
But as you look around, let's see if you think that there is some standing water in places, and if there's standing water, well,
you have a habitat.
You have a habitat.
Yeah. The specimen should be in focus, so then you can move your light anywhere you want.
The aim is to develop an app using a $6 microscope that attaches to a smartphone to help citizens identify the mosquito species that bring Zika.
I'm going to make this a little bit bigger, but you see all those red triangles right there? So here is the site that we found.
Just as in Spain, the app will also allow citizens to map locations where standing water provides breeding sites. That will alert local health authorities and trigger eradication efforts.
I have not put any samples into my phone. These are the ones that you guys have done, but it's all going, into the cloud and then into the map we all share.
If you can forget about having a Zika vaccine in time for this epidemic, but there's a lot we could be doing now. It's not highly technical, a lot of it. So it's, picking up discarded tires near homes, getting rid of plastic containers that contain standing water. All of these things don't require a PhD and they don't require an MD. I think citizen science can have an important role here.
In the developed world, smartphones and innovative sensors are changing the way environmental and health data are captured and shared. In the developing world, innovative uses of simpler technologies are allowing people to do more with less. Here's how Kenyan app developers, working with a San Francisco startup, are delivering improved health outcomes using basic $15 phones.
My name is Jen Katanu Kavita. Right now I work as the Africa Regional Designer at Medic Mobile. I come from Makueni County. Where we are right now is home. I knew that I wanted to be a nurse pretty early. My brother hurt his foot. Of course, he was playing without shoes on, and so he got a really bad wound on his big toe. So I decided to nurse him. I decided to take some warm water, put in salt, and clean it. And I was cleaning it so thoroughly and nice, and my brother was screaming, and Dad was like, "Oh, Jen, you're going to be the best nurse in the world." Being a nurse, even today, is the smile that comes in the face of my new mom when she gets her newborn baby. I used to hate every moment that we would lose a baby. And when I looked at what the causes of death, I realized it's pneumonia, malaria, all these things that just are preventable. So when I went to a seminar where somebody who was working for Medic Mobile explained how they're using technology, I was already in. I started looking for every option to get into Medic Mobile.
There are now more mobile phones on Earth than people on our planet. Across Africa, mobile banking has already revolutionized society. Now it's the turn of mHealth, healthcare enhanced by mobile technology.
You would go to some very remote area, and the only thing that they have is a signal. And if they have a mobile signal, it means they can connect to the world.
Medic Mobile founder Josh Nesbitt had worked in Malawi while studying to be a doctor at Stanford. He noticed his phone had many bars of signal, while rural communities lacked doctors.
In the last 100 years or so, we just about doubled the life expectancy for people generally on this planet, which is amazing. The problem is that we left a lot of countries and a lot of people out of that progress, and we left people behind.
Women who are pregnant have very long distances to walk just to get basic prenatal care services.
The typical distance that they would travel is between 100 and 500 miles. And that's not in their personal vehicle, that's in public transit or on the back of a motorbike.
The main health challenges that we're seeing are things that we've seen and we've known about for a really long time. It's about safe pregnancies. It's about ensuring that kids are protected from vaccine-preventable illnesses.
So it's been estimated that in the world today, there are 1 billion people who are alive that will never see a doctor within their lifetime. But in direct contrast to that, those individuals live typically within 20 to 30 miles of a community health worker.
So to me, as a nurse, community health workers are the pillars of health in the community, at least in the rural areas where we live. These are people who live within the community, they've grown up in the community, they're members of the community. So these are people who the government seeks to empower with basic knowledge on health so that they can go out to the community and empower the community to take responsibility for their health.
The idea of using technology to coordinate services came, honestly, from the way that communities were already using technology to coordinate services. We noticed that that was happening and started to create tools and systems to take the technology that's already in people's hands and enable them to do even more with it.
We use the resources that are available locally and use the mobile technology, the simplest that we have, to make sure that people access care, adhere to care, and have improved quality care.
One of the technology tools Medic Mobile has developed enables us to run programs on really low-end phones. This phone costs about $15 and is really widely used in developing countries. The battery life lasts about 2 weeks. It's really durable, and it's in the hands of a lot of people, so people already know how to use it.
Just to demonstrate how weight it goes, we put it like this underneath a normal SIM card, and we plug it inside, and voila, we have an application.
So the community health worker scrolls down and fills in the data items. So you come to the very end, and she's given the option of either going back to revise the data or to save that data to transmit it later.
This combination of smart software and simple hardware has been put to work at this rural clinic just a few hours from the capital city of Nairobi.
Kilala Clinic is located in Makueni County, and it's a very comprehensive clinic. The majority of the patients that you're going to find will be women. You'll find family members there who are caring for their mums or the babies that have just been born. It's also interesting what you won't see. You won't see a doctor.
The app helps community health workers keep track of their patients, reminding them about prenatal appointments and encouraging them to visit the clinic for a safe birth.
Before we started, we used to find many defaulters and home deliveries, but now home deliveries have reduced.
You just need to talk to the clinical officer to tell you that right now, the number of mothers that they're seeing for antenatal care visits, they've doubled.
The software allows simple text messages to convey the information content of a much more sophisticated database. Medic Mobile tools can reduce a nurse's paperwork from 10 days a month to just 1.
We used to go with the books, but that is a lot of work. But this one is very nice.
There's really only a few pieces that a clinic needs in order to get up and running. They need a laptop computer. They need a GSM modem to plug in to receive information from the phones deployed in the field. You're looking at about $15 for each one of these phones. The SIM application is also very inexpensive, and our software is open source.
Some other technology initiatives that started in Silicon Valley have failed through a lack of understanding of local needs and realities. Medic Mobile took a different path.
Our bosses are health workers and village elders and community members. It's not any other way around. And we're the best bosses in the world, and we take all of our direction from them. And it's why we build software in the first place. It's why we build systems. It's why we work every day across the world to get this mission done.
I have always known that we are the ones with the solutions to our problems.
It's pretty exciting to see us solving some problems that we didn't think we would actually tackle. So if we get a text message and it saves a pregnant mother or a mother who has an emergency and you save the particular pregnancy, that's big, man.
The kind of sensors that are being developed, everything getting smaller, the scale is getting smaller. So the scale of the research is getting more and more personal, and the size of the devices is getting more and more personal.
We want to see on a block-to-block level what air quality is doing on a minute-by-minute level.
If enough of us get together and enough of us, say, I don't want to live in a place that is this way, I'm willing to do something about it. I think policymakers and others should do something about it too. This is when freeways get moved. The first step is the citizen. The first step is the community if you want ownership for the air.
They don't have to put up with stuff. There's tools, there's resources that you don't have to be impacted by poor air quality. But we don't want to complain. We want to work with to change something.
To have something to back up your assertion that you have a problem, this is really powerful as a tool of good citizenship.
The citizen scientist to me is the best thing that's happened in a long time, because the citizen scientist is also the future civic leader. Of all the things you can be distracted with, in this day and age, I would love you to be distracted with a gadget that helps you understand how your environment is.
As we've seen, citizen science can be a win for both citizens and cities. And through the cloud, it has the potential to develop data that's hyper-local and also allow concern to go global.
And now there's all these people, not only in Spain, but in continents all over the world who are using this app, and that's amazing. And they're interacting with something, and based on our ideas, it's almost like we're having a conversation with them.
To have so many eyes for detecting so many places where mosquitoes can develop.
I think for a lot of people in my generation, global is the default. Like if you think about the planet and you are asked to draw a circle around all the people that you care about or that are worthy of your moral concern, you're going to draw a circle around the whole planet.
When you realize that small actions that really are not small, through education, through using the resources that are available, is simply just fulfilling.
If more and more people use these new tools and approaches, we can better tackle emerging threats to public health, from asthma to Zika. For The Crowd and the Cloud, I'm Walid Abdullahi.
To learn more about The Crowd and the Cloud and the stories in this series, please visit crowdandcloud.org. The Crowd and the Cloud is made possible by NSF, the National Science Foundation, where discoveries begin.